Hey there, viewers! In this video, we're diving deep into the world of supplements for depression. We'll explore the most promising options backed by scientific research, including omega-3 fatty acids, vitamin D, probiotics, and more. You'll learn about their proposed mechanisms of action, the current state of evidence, and how to use them safely and effectively. Plus, we'll discuss the importance of a comprehensive treatment approach that goes beyond just supplements. So, whether you're looking for natural ways to manage your symptoms or just want to stay informed, this video has got you covered. Stay tuned until the end for some key takeaways and actionable tips. Let's kick things off with omega-3 fatty acids, specifically EPA and DHA. These essential fats have been making waves in the world of depression research. A 2019 meta-analysis by Liao and colleagues found that omega-3 supplementation, especially with high doses of EPA, significantly reduced depressive symptoms compared to placebo. They suggested that the optimal dose of EPA for depression treatment may be 1 to 2 grams per day. So, how do omega-3s work their magic? Well, it's thought that they help by modulating neurotransmitter function and reducing inflammation. You see, omega-3s get incorporated into cell membranes where they influence the function of serotonin and dopamine receptors, as explained by Grosso et al. In a 2014 paper. Plus, they compete with omega-6 fatty acids for space in those membranes, which can lead to less production of pro-inflammatory compounds that have been linked to depression, according to Rappaport and colleagues in 2016. Interestingly, a 2008 randomized controlled trial by Jazieri et al. Found that omega-3s were just as effective as the antidepressant medication fluoxetine in reducing depressive symptoms. This suggests that omega-3s could be a viable alternative or adjunctive treatment option. But, as with most things in science, the evidence isn't entirely clear-cut. A 2015 Cochrane review by Appleton and colleagues concluded that while there is some evidence for omega-3s' benefits in depression, the overall quality of the evidence is low, and more research is needed. When it comes to dosage, most studies suggest taking 1 to 2 grams of EPA per day, often with a smaller amount of DHA. Just make sure to choose a high-quality supplement from a reputable brand to ensure purity and potency. And while omega-3s are generally well tolerated, they can cause some side effects like digestive discomfort and fishy burps. They may also interact with blood-thinning medications, so always check with your healthcare provider before starting. Moving on to vitamin D, the sunshine vitamin. This fat-soluble nutrient, produced in the skin upon exposure to sunlight, has been making headlines for its potential role in mental health. A 2019 meta-analysis by Velikat and Menon found that vitamin D supplementation significantly reduced depressive symptoms compared to placebo, with a moderate effect size. But how does vitamin D work its antidepressant effects? Well, it turns out that vitamin D receptors are found in various brain regions involved in mood regulation, suggesting a direct effect on neurotransmitter function, as explained by Isles and colleagues in a 2005 paper. Additionally, vitamin D has been shown to modulate the immune system and reduce inflammation, which may contribute to its mood-boosting properties, according to Baek et al. In 2010. A 2016 randomized controlled trial by Sapir Manesh and colleagues investigated the effects of vitamin D supplementation in patients with major depressive disorder. They found that weekly supplementation with 50,000 IU of vitamin D for 8 weeks significantly reduced depressive symptoms compared to placebo. However, not all studies have found consistent benefits. A 2015 meta-analysis by Gowda and colleagues found no significant difference in depressive symptoms between vitamin D supplementation and placebo, although they noted that the included studies had small sample sizes and short durations. As for dosage, most studies have used doses ranging from 1,500 to 4,000 IU per day or 50,000 IU per week. But it's important to have your vitamin D levels tested before starting supplementation to determine the appropriate dose for you. And while vitamin D supplements are generally safe when used as directed, excessive intake can lead to toxicity, causing symptoms like nausea, vomiting, and kidney problems. The tolerable upper intake level for adults is 4,000 IU per day, but some individuals may require higher doses under medical supervision. Next up, let's talk about probiotics, the beneficial bacteria that support gut health. In recent years, the gut-brain axis, a bidirectional communication pathway between the gastrointestinal tract and the central nervous system, has emerged as a potential target for managing mental health disorders, including depression. A 2016 meta-analysis by Huang and colleagues found that probiotic supplementation significantly reduced depressive symptoms compared to placebo, with a moderate effect size. They suggested that probiotics may exert their antidepressant effects by modulating the immune system, reducing inflammation, and influencing neurotransmitter production. In a 2016 randomized controlled trial, Akache and colleagues investigated the effects of probiotic supplementation in patients with major depressive disorder. They found that 8 weeks of supplementation with a probiotic containing Lactobacillus acidophilus, Lactobacillus casei, and Bifidobacterium bifidum significantly reduced depressive symptoms compared to placebo. However, as with omega-3s and vitamin D, not all studies have found consistent benefits. A 2018 meta-analysis by Eng and colleagues found no significant difference in depressive symptoms between probiotic supplementation and placebo, although they noted that the included studies had small sample sizes and used different probiotic strains and doses. When it comes to dosage, most studies have used doses ranging from 10 to the power of 9 to 10 to the power of 10 colony-forming units, or CFU, per day, often containing a combination of Lactobacillus and Bifidobacterium strains. Probiotics are generally safe and well tolerated, but they can cause side effects like digestive discomfort, bloating, and gas, especially when first starting supplementation. As always, choose a high-quality supplement from a reputable brand and store it properly to ensure the viability of the beneficial bacteria. Beyond omega-3s, vitamin D and probiotics, several other supplements have shown promise in managing depressive symptoms, although the evidence is less robust. S-adenosyl methionine, or SAMe, is a naturally occurring compound involved in the synthesis of neurotransmitters like serotonin and dopamine. A 2017 meta-analysis by Sharma and colleagues found that SAMe supplementation significantly reduced depressive symptoms compared to placebo, with an effect size comparable to that of antidepressant medications. Zinc, an essential mineral that plays a role in neurotransmitter function, has also been linked to depression. A 2013 meta-analysis by Swordfager and colleagues found that zinc supplementation significantly reduced depressive symptoms compared to placebo, particularly in individuals with low zinc levels. B vitamins, especially folate and vitamin B12, are involved in the synthesis of neurotransmitters and have been linked to depression as well. A 2015 meta-analysis by Almeida and colleagues found that vitamin B12 supplementation significantly reduced depressive symptoms compared to placebo, although the evidence for folate was less consistent. Magnesium, an essential mineral involved in various aspects of brain function, has also been studied for its potential antidepressant effects. Low levels of magnesium have been linked to depression. In a 2017 randomized controlled trial, Tarleton and colleagues found that magnesium supplementation significantly reduced depressive symptoms compared to placebo in adults with mild to moderate depression. Finally, let's talk about saffron, a spice derived from the Crocus sativus flower that has traditional uses in treating mood disorders. A 2013 meta-analysis by Hausenblas and colleagues found that saffron supplementation significantly reduced depressive symptoms compared to placebo, with an effect size comparable to that of antidepressant medications. While these supplements show promise, it's crucial to remember that they are not without risks. Always consult with a healthcare professional before starting any new supplement regimen, especially if you have pre-existing health conditions or are taking medications. Choose high-quality supplements from reputable brands that have been third-party tested for purity and potency, and follow recommended dosages and instructions. Be aware of potential interactions between supplements and medications, as some supplements can alter the effectiveness or side effects of drugs. And of course, monitor for any adverse effects and discontinue use if necessary. It's also important to remember that supplements are not a substitute for a healthy lifestyle and professional medical care. Engaging in regular physical activity, maintaining a balanced diet, getting enough sleep, and managing stress are all crucial components of a comprehensive approach to managing depression. In conclusion, several supplements have shown promise in managing symptoms of depression, either alone or as adjunctive therapies. Omega-3 fatty acids, vitamin D, and probiotics have the most robust evidence supporting their use, with several meta-analyses and randomized controlled trials demonstrating their efficacy. Other supplements like SAMe, zinc, B vitamins, magnesium, and saffron have also shown potential benefits, although more research is needed to establish their optimal use and long-term safety. Remember, supplements are not a replacement for professional medical care and should be used under the guidance of a healthcare provider. Depression is a serious condition that requires a comprehensive treatment approach, often involving a combination of therapy, medication, and lifestyle changes. When considering supplements for depression, choose high-quality products from reputable brands, follow recommended dosages, and be aware of potential interactions and side effects. Consulting with a healthcare professional can help ensure that supplements are used safely and effectively as part of an individualized treatment plan. While supplements can be a useful tool in managing depression, they are just one piece of the puzzle. Engaging in regular physical activity, maintaining a balanced diet, getting enough sleep, and managing stress are all important aspects of a holistic approach to mental health. As research continues to explore the role of nutrition and supplementation in mental health, our understanding of the most effective supplements and dosages for depression will likely evolve. Staying informed about the latest research and working closely with healthcare professionals can help individuals make informed decisions about incorporating supplements into their depression treatment plan. And that's a wrap. We hope this deep dive into supplements for depression has been informative and helpful. If you want to learn more about these supplements and other natural approaches to mental health, head over to nutritionmarket.com.au. There, you'll find a wealth of information and resources, plus a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to get personalized guidance on your mental health journey. Before you go, remember to hit that like button and subscribe to our channel for more evidence-based nutrition and health content. And as always, keep in mind that while this information is based on scientific research, it's not a substitute for professional medical advice. Some of these findings are still under investigation, so be sure to consult with your healthcare provider before making any changes to your treatment plan. Thanks for watching, and until next time, take care of yourselves and each other.